everyone. Thank you for joining us today. My name is Mary Moko. I'm a specialist on the Provider Outreach and Education team at WPS Health Solutions. Also helping today is my friend and colleague, Karen Curtis. Karen is helping to make sure that things run smoothly behind the scenes. Also joining us is my friend and colleague, Tom Ryan. Karen will be monitoring the chat and adding some links and other helpful resources for you today. This is the 6th session in 7 webinars that I'm hosting, and these are really designed to provide an entry-level introduction to Part B original Medicare outpatient mental health services. All questions submitted today via the chat function should be related to the topics that we're covering in today's session. Now, if you'd like to catch up on the past sessions, you can view them on our YouTube channel and on our Encore Presentations webpage. That's out on our website when those Encore presentations are posted there. They'll stay out there for about 60 to 90 days, but they will remain on our YouTube channel as long as that information remains current. Now, we've created this education today, and we did so based on survey responses from you, our provider community. We do review the surveys that we receive following our events, and we take those responses very seriously as ways to improve our customers' knowledge and overall satisfaction with WPS. Both WPS and CMS review that survey feedback, and this is what shapes our plans for future education. I invite you to visit our training center that's out on our website. We do post event materials for webinars a few days in advance. So if you want to download a copy of the slide deck, you can find it out on that live events webpage. This is also where you can find out about and register for upcoming educational events. The recording of this and other live webinars will be out on our website as an encore presentation for anyone who missed the event or wants to listen to it or parts of it again. Now, depending on the number of events, they're normally going to be available 60 to 90 days. You can also find them out on our YouTube channel. We will be using the chat feature today to add any questions that you have related to topics for today's webinar. And at the end of my prepared remarks, I'll take as many questions as time permits. Whether you're listening live or to the encore, we hope that you will take this opportunity to give us your feedback by taking a brief survey. Those surveys give us insight into how we're doing and the types of education that you want and need. Here's a disclaimer that we include in all of our education. It lets learners know that the information that we are providing is accurate and complete to the best of our knowledge. As a government program, Medicare does change, so federal rules and regulations will always prevail. And these are what determines final coverage. You can find coverage regulations and rulings out on CMS's website. And finally, I want to draw your attention to the sign that you see here on this slide. CMS prohibits recording of this presentation for profit-making purposes. Because WPS records and makes our education available for playback, we ask you to refrain from recording any portions of this presentation in any manner. So let's talk a little bit about the agenda for today. If you read over the announcement for this webinar, you will hear the words that I'm going to speak coming up. That is what it is that I plan to talk about today in my prepared remarks. I am going to discuss telehealth requirements. I'm also going to demonstrate how you can find CMS's list of telehealth services. I'm going to include some information about billing and payment details, and throughout the entire presentation I'll be sharing some valuable WPS and CMS telehealth resources. Before I get started, though, I do want to talk just a little bit about this CPT copyright notice. This is the American Medical Association's copyright notice for CPT codes, descriptions, and other data. Your continued participation in this webinar infers that you agree to the terms of this copyright notice. I've included a list of acronyms for reference should you need them during today's presentation. You can refer back to this slide. Now, as stated in the webinar description, this webinar is designed as an entry-level introduction to Part B outpatient mental health. This is for traditional or original Medicare. One valuable resource that I use as my mental health go-to is the CMS Medicare Learning Network, or MLN booklet. It's titled Medicare and Mental Health Coverage. It is in this booklet that you'll find much of the information that I've been presenting in these multiple sessions. I've been doing this since October of this year. You can find information about telehealth on page 7 of this booklet. It is very important to note the date that this product was last reviewed and published. So in this case, if you look at the bottom of this booklet, or at the bottom of the page of this booklet, you will see MLN 1986542. That's the product identification that's found at the bottom of each page. And you'll notice that this particular MLN booklet was last updated July of 2024. That means that any changes due to the publication of calendar year 2025 physician fee schedule final rule is not included in this particular CMS product. Now, Medicare has seen a rapid rise in telehealth in recent years. Healthcare providers use telehealth to meet their patients' needs, and this slide lists the benefits of behavioral telehealth. Of course, there's convenience. Video and phone appointments between a patient and their healthcare practitioner benefits both health and convenience. There's also benefit of a broader reach and fewer barriers. Health equity in telehealth is the opportunity for everyone to receive the health care they need and they deserve, and this is regardless of social or economic status. There have been great strides to assure fewer barriers and advances in technology. Providing health equity in telehealth means making changes in digital literacy, technology, and analytics, and this will help telehealth providers reach the underserved communities that really need it the most. It's important to understand that medical necessity is a requirement for any Medicare payment. It is the Social Security Act that states Medicare payment may only be made for items and services that are medically necessary. This is the overall criteria for Medicare payment. First and foremost, the service needs to be medically necessary. You'll see on this slide and throughout the presentation there are many embedded links to many of the resources that I use to pull this information together. So I just wanted to take a moment to point that out to you. You can actually click on these embedded links and see those references that I used and that I'm quoting or citing throughout this presentation. Now, you can find national and local coverage determinations that define medical necessity out on or by searching the Medicare coverage database. I've embedded the link here on this slide. So how does Medicare know that the service you're providing is medically necessary? For each service billed, the claim must indicate the specific sign, symptom, or patient complaint that is the reason for the service that's being reported. WPS has published a local policy, or we call those local coverage determinations, or LCD for short. And that title is, the title of that policy rather, is Psychiatry and Psychology Services. It is this local policy that includes the coverage indications, limitations, and medical necessity coverage. That is the guidance for Part B mental health services billed by WPS Jurisdiction 5 and Jurisdiction 8 providers. So it applies only to those providers that are billing these services in Jurisdiction 5 and Jurisdiction 8. I've included a link to our policy and to the billing and coding guidelines for our local policy on this particular slide. Now, sometimes we refer to that billing and coding guideline as the article. Sometimes we call it the companion article. Some folks even call it the companion document. What we're talking about there is that article or that billing and coding advice that is really a companion to the local coverage determination itself. We do include a link to the companion article near the end of our actual policies. So in addition to being medically necessary, services must be otherwise covered by Medicare. So what do we mean when we say the service has to be medically necessary and otherwise covered by Medicare? It means that the service must meet other requirements for payment. Now, this varies depending on what kind of service is being billed, but there are other examples of services that are otherwise covered that really applies for any service that you're rendering and submitting to Medicare. There are examples here on this slide. The service cannot be a duplicate, means has to meet statutory requirements. And what we mean by this is that there are laws that govern the coverage of that item or service. Of course, the service would need to be submitted correctly by an eligible provider. That means someone enrolled in Medicare, for an eligible beneficiary or someone who is entitled to Medicare. And of course, it needs to be coded correctly. And there are more examples of this. I just wanted to list some of them here for you. So if you hear someone at WPS say medically necessary and otherwise covered, these are the kind of considerations that we're talking about. And of course, if there's coverage guidance or billing and coding guidelines, those would be other examples of otherwise covered. It is CMS that maintains the list of services that are payable under the Medicare physician fee schedule. And this includes codes, a short descriptor, and a category. And what I'm talking about now, I need to back up a little bit, are that list of services that are payable via telehealth. And that's what we're talking about today. So it needs to be medically necessary, otherwise covered by Medicare, and it needs to be on that CMS list of services that are payable via telehealth. The category on that list shows whether the coverage of that service via telehealth is provisional or permanent. The lists that are prior to 2025 show whether audio-only interaction meets requirements. This column is no longer showing on the 2025 list. CMS put into place some exceptions during the COVID era. Many of those special exceptions or waivers, if you will, are going away now. So in 2025, that ability to render many of the telehealth services via audio-only interaction is gone, except for mental health or behavioral health telehealth. That remains a permanent change for those of you that are billing those kind of services. So this code is taken away on the 2025 list, but it does remain a permanent change that you can use audio-only interaction for telehealth when you're rendering a mental or telehealth behavioral service. And I'll get to that in just a bit and explain more about that. Now, sometimes the list of payable services is affected by other acts of legislation. For example, the calendar year 2023 Physician Fee Schedule Final Rule aligns the list of telehealth services with the extension time frame that was enacted by the Consolidated Appropriations Act, known as CAA of 2022. Later, when Congress passed the act in 2023, it further extended those flexibilities, and that's what I was talking about. So we need to make make certain that we're checking this list when billing services to Medicare. And remember that telehealth services for a mental health provider is very different than telehealth services or other provider types. So despite the changes that come and go, you can find that current list of telehealth services on the CMS website. I've included the link to the list of telehealth services webpage so you can download and view the list of services payable via telehealth by calendar year. Sorry about that. I went too far here with my scroll. You will need unzip software in order to view this list. So just recently, it was actually November 1 of 2024, CMS updated that list. So the list of telehealth services for calendar year 2025 is now what shows on the CMS website. So I do want to demonstrate and show you where you can find that information. And again, your handout includes links to this particular page. Oh, here we go. Sorry about that. Just very touchy today. So your handout includes the link to this page. This is the list of telehealth services. Here on the bottom of the page, you will see the Medicare telehealth originating site facility fee reimbursement amounts for Q3014. That's what the distance site provider bills. You will see that for 2025, CMS will reimburse $31.01 for that particular code when it's reported on a Medicare claim. In 2024, that facility fee reimbursement was $29.96. So in order to view that list of telehealth services for calendar year 25, you'll need to click here on this link. And as I mentioned to you, and you can see by this here, zip, it is a zipped file that you will need to unzip in order to view. Because that takes a little bit of time and often takes a little bit of time to open, and it doesn't always open correctly sometimes. I wanted to just have it opened up and ready to show you during this demonstration. So when you click on that link and you unzip this particular file, this then is that final list of Medicare telehealth services. This is the list of services for 2025. And I, when saving this, made sure I saved the particular place within this list that shows you the psychotherapy codes or the codes that a mental health provider or behavioral health provider would be submitting to Medicare. So those are right here for you. You can see in column B, CMS identifies the HCPCS code, CPT code. There in column C is the short descriptor of that code. In D is the finalized action for that. Is it maintained or is it changed from last year? And then E, this category code is something that I touched upon already just very briefly. Is it provisional or is it a permanent change? And you will see here that for the CPT codes for the mental health services, there's more of them that come on down here. These are permanent additions to the list of Medicare telehealth services. Now, what's missing from this 2025 list as compared to the 2024 list is a column that tells providers whether that service can be rendered via telehealth using audio-only communication. Well, CMS took that column out of the 2025 list, the one you're looking at right now, because it no longer applies for most providers. It does, however, apply for mental health providers. So although that code is gone that says whether you can do it via audio only communication, you need to know that if you're billing a mental health service to Medicare, you can render that via audio-only communication. And I'm going to talk more about that in just a little bit. I just wanted to note and let you know that that column is now gone because for most providers, they can no longer render telehealth via audio-only communication. Okay, we'll talk more about that because the rules for mental health or behavioral health is different. So this slide then expands a bit on the processes to add to that list of telehealth services. Any interested party from the public or private sector may submit a request for additions to the list of telehealth services. CMS does provide an email address to which requests for additions or deletions should be emailed to, and they do this on their requests for additions webpage. You can see that I've linked to it here on this slide, or this includes an embedded link. Now for each service, or each request rather, for adding a service to the list of Medicare telehealth services, there must be certain items provided, and you can find a list of the items by choosing the link on the Request for Additions webpage. And this list includes such things such as the name, address, and contact information for the request, a description of the type of medical professional providing the telehealth service at the distance site, and then an explanation and evidence to support adding that service to the list. So there's also a web page for CMS review criteria for submitted requests. It describes each of the two categories that Medicare telehealth services are assigned to. Since the category is one of the items the requester must include in their request to add to the list of telehealth services. Category 1 services are services that are similar to professional consultations, office visits, and office psychiatry services that are currently on the list of telehealth services. And Category 2 services are those that are not similar to the current list of telehealth services. So any interested party from the public or private sector may submit a request for an addition to the list, and some examples are listed in the last sub-bullet here. All right, next. Also included on CMS website is a list of outcomes that may result when CMS reviews the requests to add to the list of telehealth services. I'm not going to go over each and every one of these, but you can find some examples here on the slide. They could add that existing code to the list of service, or add an existing code, I should say. They might notify the requester that a national coverage determination is necessary before a decision to accept or reject that request to add to the list, or they could simply reject the request to add that particular item or service to the list. So just some things to know that are possible review outcomes when CMS is asked to add to the list of covered telehealth services. Now, services currently on the list of Medicare telehealth services could be removed if, upon review of the available evidence, CMS determines that that Medicare telehealth service is not safe, is not effective, or is not medically beneficial. So in addition to adding to the list, CMS could take away from the list of telehealth services. These additions or deletions to the list are effective on a calendar year basis. Changes are made using the annual physician fee schedule proposed rule. That's the proposed rule that is published in the summer, and then the final rule is published by November 1 of each year. Requests can be submitted on an ongoing basis or anytime during the year. However, in order to be considered for publication in the next annual notice, CMS must receive that request by February 10th. So here's a summary of the changes that you will find on that 2025 telehealth services list. And again, this is based on the information that was published in the final rule. That is the calendar year physician fee schedule final rule. So as you can see, CMS finalized addition of several codes. They've also added several codes on a permanent basis. Remember that list of codes mostly for providers other than mental health or behavioral health, has a lot of provisional codes. That means that they're there now, but they haven't been added on a permanent basis. They could be in the future, but as of right now, they're provisional. They're covered provisionally, not on a permanent basis. So for 2025, there are several codes now that do appear as a permanent addition to that list. This is what I've been talking about a couple of times, and I really want to stress to this audience, because this webinar is designed for Part B mental health providers, that the guidelines to follow when telehealth services are being billed are very, very different. So rules are different for these two situations. When the service is for diagnosis, evaluation, and treatment of a mental disorder, or when the telehealth service is for treatment of substance use disorder, SUD, with co-occurring mental health disorder. Now, CMS does not provide a list of diagnosis codes that describes these. Providers should ask themselves the questions: are these services for diagnosis, evaluation, and treatment of a mental disorder? Are these services for treatment of substance use disorder with co-occurring mental health disorder? To know whether the rules for mental health telehealth apply. Of course, it is in the provider's documentation that should show the justification for the treatment being for these reasons listed here on this slide. Now, I keep mentioning to you that rules for mental telehealth or behavioral telehealth are different. Here is some follow-up on that. I told you I'd be going into this a little bit later. CMS permanently permits use of interactive audio and video technology or via audio only communication for mental telehealth. So let me go back to this slide. What is mental telehealth services? Right here, these two reasons. If your documentation justifies that the services are being done for these reasons, you can follow the technology guidelines for Medicare mental telehealth. Now, this is that example that I've been talking about where rules for mental telehealth differ than rules for mental telehealth. HIPAA privacy rules, the Health Insurance Portability and Accountability Act privacy rules, allows audio-only services as long as the patient's identity is verified orally or in writing. Providers must take steps to protect the patient's protected health information. The distance site provider must have the technical capability to use an interactive telecommunication system that includes video. So you have to have the ability to use video, but the patient must be incapable of or fail to give consent for the use of video technology when you decide to bill via audio only. So to indicate that the telehealth service is delivered via audio only means you have to append an appropriate modifier, which we'll get to in just a little bit. Now, here are some of those permanent guidelines for mental telehealth, including the technology one that I just talked about. CMS, or based on final rule or legislation, has indicated that there will be or there are no geographic restrictions for the originating site. And the originating site is where your patient is located, and that now includes patient's home. This is a permanent guideline for mental telehealth services. You can use an audio-only communication platform. That's a permanent help. And although I'm not, or this particular webinar wasn't designed for rural emergency hospitals or federally qualified health centers and rural health centers, I did want to include information for those here on this slide. Rural health emergency hospitals are now eligible originating sites. This is a permanent rule, and FQHCs and RHCs can serve as distance sites. Here are some temporary guidelines being addressed here on this slide. 2020 legislation called for implementing a rule that a person having mental health telehealth would need to have an in-person visit in the prior 6 months and then annually thereafter, but subsequent congressional action has temporarily delayed this requirement. That temporary delay is still in place. So this has not been acted upon. Legislation or rulemaking has temporarily delayed this requirement. So there is no requirement for that visit within the prior 6 months and annually thereafter. If that changes in the future, you'll be notified and it will be done in rulemaking. So we know that at least through 2025 calendar year, there will be no change. Now, to report the place of service for mental telehealth after May 11 of 2023, you use the place of service 02 when telehealth is provided other than in the patient's home. So what we're talking about here is when you are billing for the originating site service. That is where the patient is located. Report the place of service 10 when the telehealth is provided in the patient's home. For all other originating site services, use place of service 02, and that is after May 11 of 2023. Here are some descriptions for modifiers that are used for mental telehealth. Direct supervision of mental telehealth is no longer required. Instead, it is general supervision that is required. And this is different for mental health providers than it is for other provider types. Today's focus are Part B mental health providers that we're talking about. So no longer direct supervision required, general supervision is required. So the FQ, it means telehealth furnished using real-time audio only communication. FR is used to indicate the supervising practitioner was present through real-time two-way audio video communication. That is no longer required, but in some situations there may be real-time two-way audio video communication during that mental health telehealth service, and you might choose to then report this particular modifier, the FR. Again, Medicare no longer requires it, but there may be situations where you are providing that real-time two-way audio video communication. Just because you don't have to do it anymore doesn't mean you might not, or that you might do it. So that is still a valid modifier. Here are more modifiers for telehealth. A 9.3 is used for those situations when telehealth is furnished audio only. You can use the FQ or 93 or report both. And then just a final notice about another modifier for mental health telehealth that I've included here is one that is no longer being used. So you should no longer report the modifier 95 after 5/11 of 2023 for mental telehealth services. Here's some information that's related to Medicare payment for mental telehealth in the distance site. And what we're talking about here is where the provider is located. Medicare pays based on the current facility rate fee schedule for the services that are within that practitioner's scope of practice. For those of you that are unfamiliar with that verbiage, scope of practice is based on your state regulations for providing the service. So this really correlates to certification or licensing by the state in order to render the service. So any service that's being rendered for a Medicare beneficiary must be one within state scope of practice. You know, we can't have a provider rendering something that his or her state does not allow them to perform. Providers report the professional service that they render and document in the patient's medical record. The beneficiary has to pay then for any unmet deductible and the applicable coinsurance. Medicare has been discussing enrollment of the distant site practitioner's home location when rendering telehealth services from their home. Those discussions have been going on for a couple of years. However, in their calendar year 2025 physician fee schedule final rule, they state that at least through calendar year 2025, they will continue to permit distance site practitioners to use their currently enrolled practice location instead of their home address when providing telehealth services from their home. Here's some information that relates to Medicare payment for mental telehealth in the distant site. That is where the provider is located. Again, we're going to make reimbursement for the distant site service, or excuse me, the originating site payment um, at with the facility fee, the Q3014. We're going to base that on the physician fee schedule amount that is shown. I showed you this earlier on the slide. Let me just show you here. And this is the reimbursement made for originating site. That's where the beneficiary is located, and it is for 2025. That facility fee, when Q3014 is reported on the claim, will be reimbursed $31.01. So facility fees are a separately billable Part B service. Payment methodologies, as you can see here, for each facility type can be found in the CMS Internet-only manual publication. The beneficiary pays for any unmet deductible and applicable coinsurance. So that's how we reimburse for the originating site. The physician, of course, would report on the distant site claim the CPT or HCPCS code that he or she is rendering in documents in the medical record documentation. Okay, so kind of two sets of charges being billed, one for the originating site, one for the distant site. Now, I've provided many resources for you throughout this presentation, including that Medicare Learning Network booklet that I talked about at the very beginning of my presentation. I've showed you resources out on CMS's website. In addition to those resources that I've linked to, I did want to provide for you another really great telehealth resource, and that is the Health and Human Services website that includes behavioral health care specific details, including those listed here on this slide. They've categorized it, into getting started, developing a telebehavioral health strategy, billing for it, and preparing patients for telebehavioral health. These are some really great resources for you, and I did want to share them with you. This is another go-to place for me when I'm looking for the latest and greatest information about behavioral health care telehealth services. Before I open up for questions and answers, I do need to share some information with you, a couple of different topics. The first is this one, and this relates to directives that CMS published in their change request. The change request is 13754. There is an embedded link on this slide. WPS will remove the interactive voice response, or IVR system, patient eligibility functions, and this is in response to those directives issued in that change request that I just talked about. Now, those directives in that change request don't apply only to WPS, but they also apply to other MACs as well. While this function will no longer be available on January 1 of 2025, that is the date that WPS is removing eligibility functions from our IVR system, you do still have access to patient eligibility. It's just found in other resources, and they're listed here on this slide. We have been, our provider outreach and education staff at WPS has been hosting multiple webinars about this change. We've been talking about the other tools that you can use to get that needed eligibility information. You can look for the encore presentation named WPS Secure Website, locating eligibility information on our Encore Presentations webpage and out on our YouTube channel if you're looking for more information on that. And keep your eyes tuned to or turned to our training center for additional webinars that we'll be hosting about finding eligibility resources elsewhere. This last little bit of information I want to provide before opening up for questions deals with health equity, and this is the attainment of the highest level of health for all people, where everyone has that fair and just opportunity to obtain their optimal health outcomes. And this is regardless of several different things, race, ethnicity, disability, sexual orientation, so on and so forth. So we do want to share this information with you to let you know that WPS shares CMS's goals to make achieving the highest level of health and well-being attainable for all people. You can access the CMS Framework for Health Equity webpage using the link that's embedded here on this slide if you want to learn how you can help ensure that every person can access care at an affordable cost. That brings me to the end of my prepared remarks. I am going to open for questions that you have regarding telehealth. If you have questions on other topics that I've covered in this series, I will be hosting on Thursday of this week a Answers to Common Questions webinar on Thursday if you have topics that are unrelated to telehealth. But right now, telehealth questions for Part B providers. These are those providers billing on both the CMS 1500 claim form or the 837P electronic professional claim. Karen, do we have any questions?
Hi, Mary. Thanks for that great information. We do have one question I kind of wanted to start out with, just for clarification. Amy asked, for substance use disorders with co-occurring mental health disorder, is the substance use disorder a mental health disorder, or would they need additional mental health disorders to qualify?
As long as that substance use disorder is documented in the medical record, you would be eligible to bill Medicare for that mental service via telehealth.
Okay, thank you.
It's really going to be based on the documentation.
Okay, the next question was asking for clarification on what is considered the patient's home. So when you're billing the 02 or the 10, is it only a private residence, or does it include a nursing home or assisted living if they don't have a private residence or home?
It is the patient's residence. If it's in a nursing home or elsewhere, you would use the 10 place of service.
Okay.
The 10.
Another question we have is, can you please clarify that the FQ modifier is for rural health and non-rural providers would use modifier 93 for audio only?
I can't speak to the rural health because this is specific to Part B coverage today. I'm not I'm not covering the billing by the rural health clinics. But let's go back to, it's really kind of up to the provider. They can use, let's go back to that slide. Here, you can use the FQ or 93 or both when you're furnishing telehealth services audio only. I'm not talking about the RHC or the FQHC claims because I'm not including those in today's presentation. But for those services, either the FQ or the 93 or both can be billed.
And Mary, while we're talking about modifiers, is there a modifier for telehealth that is both audio and visual, or is it just audio only?
Right here, telehealth furnished. Oh, real time only. I'm sorry. This one would, whoop, I'm so sorry. Click too soon. The FR is that the supervising practitioner is present. Let's see, audio visual. There is no modifier. No, these are the only modifiers that would pertain to the mental health telehealth. Nope. So we don't need to know if it's being furnished audio visual, but if it's being furnished audio only, then we do need to know. Good question.
Okay. Sorry, I'm just trying to
That's
make sure
okay.
that these pertain to the telehealth.
Yeah, and we did receive some good questions when you registered for today's presentation. They were those that I included answers to in my presentation material. So today, again, we are looking for those questions that pertain to telehealth. If you have questions that do not pertain to telehealth, we're happy to address those in Thursday's presentation. Or what you may want to do, I'm going to open this and show it to you just here. Show you where you can find answers to those. Oh, sorry, I had this open and I bumped it. All right, so this is our website. Make it a little bit bigger for you. The WPS website. If you go to the training center located at the top center of the page, I'm just going to choose J8 Medicare Part B or MAC Part B. You can also choose J5 depending on what jurisdiction you're in. You do need to accept the licensure agreement. I told you earlier about those encore presentations. If you choose encore presentations from our training center, you will find a list of all those recordings that are available. December 3rd was bundling that I talked about. In November, there was some Part B billing, I believe, for mental health. I got to scroll down further. Sure. Here, Part B, eligible provider types and reimbursement. If you have questions on some of those other categories, if you will, or those topics covered in previous webinars, you can take a look at these encore presentations. And remember that we also publish the encore presentations out on our YouTube channel. To get to our YouTube channel, you can go to the training center. Here's where you find live events, encore presentations. Right here is some information on our YouTube channel. You can actually link to or visit and subscribe to our YouTube channel by using the embedded link. Here is the takes you right to the channel itself. Links back to the Encore Presentations webpage. And then we provide the list of playlists here, and there is a mental health playlist available out on our YouTube channel. So a lot of great information available out under that training center. So if you want to listen to some of those previous recordings for the mental health sessions that I've been hosting, you can look out on the Encore Presentations page or the YouTube channel. And also we have that Answers to Common Questions webinar coming up on Thursday. Anything else?
And Mary, we got one more question, and this is just kind of broad, but is there any news about expansion for telehealth after 12/31 and 24? Is there any movement in Congress?
The only changes that we would know of are anything that has been published in that calendar year physician fee schedule 2025 final rule. And you can find that out on CMS's website. Let's see. I just do a simple search of calendar year 2025 final rule, and I should add to it. There's different types of final rules, but the one that you'll want to look to for Part B is the physician fee schedule final rule, which is what the PFS stands for. And we can put this into the chat box if you'd like. If you're able to do that, Karen, go out and grab this. This here is the fact sheet. They call it fact sheet for the calendar year 2025 Medicare Physician Fee Schedule Final Rule. This one is for Medicare Parts A and B. And this would have any changes that came about that are applicable for 2025. So here is telehealth services for 2025. And this information is information that I included in the presentation today. Okay. So you will have that information as it pertains to telehealth, that is. Okay. These are the only changes that we know of now. These are the only ones that have had congressional action. So we have nothing further to report at this time. Okay. Talks a little bit about the interactive telecommunications system, which can include the two-way or audio only. Okay. Telehealth for mental health or behavioral health. And we continue to get those questions. Well, how do I know if this qualifies? You really need to look in that medical record documentation to see if it would qualify for mental health or telehealth, behavioral health, telehealth. We can't tell you whether it does or doesn't. It's based on your documentation. And of course, we don't have that. So the question you need to ask again yourself is something way back at the beginning of my presentation or earlier on in the presentation, if it relates to that the mental health services or the substance use disorder with the co-occurring mental health disorder. Okay. Medicare can't make that determination. It's back on, let me go back here. I'm going to move back through the slide deck here because we continue to get questions about this, and this is the only information we have to provide you with. If the service is for the diagnosis, evaluation, and treatment of a mental disorder, or if that documentation shows it's treatment for substance use disorder with a co-occurring mental health disorder, it is the rules would apply for you for the mental health services. Okay. That is for telehealth specifically, that these services that are added to the list that you can bill are permanent. They're forever. They aren't going away. And I think CMS is doing that. When we know that CMS is doing that for the reason is to make certain that people are getting that care that they need. Access to care, it's all part of this health equity and movement to make certain that everyone has access to care at an affordable cost. Okay. Any other questions, Karen? We have a couple minutes left here.
Mary, that's all we have that's actually related to the telehealth topic.
Okay, all right. And we do appreciate your questions on other topics, but we need to make certain that we're keeping them only to the topic we talked about today, so that those people that do have the questions about telehealth can have them answered in due time, and we can get through all of the information that we need to give you during our presentation, which of course includes giving you some information about how those of you that are seeking continuing education units can receive or will receive a certificate of achievement. In a few minutes, you will receive an email to thank you for your attending. That is those of you that did not join via telephone. If you need or you're seeking those continuing education units, do not delete the email without reading it. This email is going to contain that important certificate of achievement. It's going to look similar to what you see here on the screen. The bottom right side where we have the red square, it's going to have your name and the contact hours. It will have the name of the presentation today. If you don't see it, make sure to check your spam or your junk mail, and also make sure to add the WebEx email address to your Safe Sender list. That way you will be able to receive these in the future. They won't get delivered to your junk mail or your spam. For those of you listening as an encore, we thank you for your interest in education. Unfortunately, we don't have any way to verify attendance for those encore presentations, so a certificate is not possible. Now, if you joined today by telephone, you can send an email to our education mailbox. It is at the very bottom of this slide and on the next one. Give me your name, the telephone number you called in from, and the name of today's event, and we'll get you a manually created certificate of achievement. When you join by phone, WebEx does not know the email address to which they need to send a certificate of achievement. They don't have all of that information, so it then becomes a manual process, but we will make certain you get that if you need it. If you think of a question later, you do have 1 week from today to submit any follow-up questions. You can send them to that education mailbox that I just talked about. That email address is shown here on this slide. Put today's date, something about mental health, telehealth in the subject line, and the staff in outreach and education that is looking at those incoming emails will know to send that question over to me. After 7 days, I'll take a look at any of those questions, those that weren't answered during the presentation, and I will create a list of questions and answers and email them out to everyone, or I will respond directly to an individual learner if I decide that is the best way to handle any question. Now, I can't answer any claim-specific questions because I don't have access to claim history. Our customer service folks are happy to help you if you have a claim-specific question. They have access to historical information and claims processing information that we in provider outreach and education do not have. Please do take a few minutes to complete that brief survey that I talked about earlier on today. Tell us what you liked, what we could do better. This gives you also a great opportunity to suggest topics for future education. You have various options in completing this. It really does depend on your preference. You can use the link in the chat, or when you exit the webinar, you can go to an external site, and that external site is the CMS Qualtrics page for the brief survey we'd like you to take. The message is going to look like the picture on the right side of this slide. It's the one with the yellow triangle, and there is a blue button that says continue on it. If you're listening to the encore, a box will appear that links you to the survey. It will also look like other examples here on this slide. So you can scroll down in the description for the video to find the link. Let us know if you would recommend our education to others. That's the greatest compliment, I believe, is knowing that someone recommended our education to others. How likely are you to attend other events we host? Those surveys really give us insight into how we're doing and the types of education that you want and need. On behalf of myself, Karen and Tom and the entire provider outreach and education team, I do want to thank you for your participation. We hope to have you join us for future education, and we look forward to that important survey feedback. You may now disconnect.